I thought we could talk about trachs. Funny story, when I was a brand new ICU nurse, I had gone through my whole orientation, like 12 weeks or so, and did not have a single trach patient. And my first day off of orientation, I had two trachs, and I was like, confiding in my preceptor, I was like, what do I do with this? Trachs really intimidated me at first, and I think that's just because it took some time to get exposed to them. And now, like, trachs are so common in the ICU world that, like, it's no big deal. So let's talk about them. Also, side note, does anyone like really want to change these trach ties? Trach is placed by a procedure called a tracheostomy, and it's a little hole that goes into the patient's trachea or windpipe, the tube that they breathe out of, and it allows the patient to now breathe through that hole. A trach can be a permanent thing or it can be a temporary thing, and it is typically a procedure that is done with consent. So it is a planned procedure. Now, there are times where an emergency trach may be placed, but typically getting a trach is like a planned procedure that has been consented for by either the patient or their medical power of attorney. There are lots of reasons why patients may need a trach, so let's talk about some of the common ones. The first one, this is probably the most common one I see in the medical ICU, is prolonged ventilator dependence. After about 2-ish weeks plus or minus of being on a ventilator, there's a lot of risks that come with prolonged ventilator use, especially when you're ventilating through a breathing tube. And so we will typically place a trach on patients that are on a ventilator long term that we're unable to wean them and get them extubated. And this is so that way we can reduce sedation, we can get patients hopefully a little bit more mobile and active. Not to say you can't do that with a breathing tube, but it tends to be a little more comfortable for patients. Again, this is going to be a permanent thing or a temporary thing, and that should definitely be put in the consent when the provider's talking about it. Is sometimes trachs are permanent, and not all providers are quite honest about that. Sometimes patients will get a trach placed if they're having like a head or neck surgery, especially like for cancer. If they're getting cancer removed, they'll put a trach in to have that like stable airway in case there's any swelling. I've also seen trachs placed in patients that are really obese, that have like obese hypoventilation syndrome, where they are retaining a bunch of CO2 because they aren't able to ventilate well enough on their own, and they'll get a trach and be hooked up to a ventilator. Bad sleep apnea, refractory to other treatments, chronic aspiration. A lot of times patients will get a trach, but then they also need a feeding tube. Neuromuscular diseases, so like your muscular dystrophy, where patients are getting weaker and weaker and those respiratory muscles are weaker, eventually a lot of them need a trach. Trachs can also be placed in emergency if there's any like major trauma where you're unable to put a breathing tube in through the mouth. Those are some of the quick reasons patients need trachs, and I could talk so much more about the procedure of trachs and some care for it, so let me know what you want to see next in regards to trachs.